Hello, my name is Zachary Smith, and we are doing the article critique review of understanding the challenges of encountered and adaptations made by community organizations in translation of evidence-based behavior change physical activity interventions. The author is Diana Lattimore, Sarah Griffin, Sarah Wilcox, Carol Ramoon, and Diane Dowdy, and Laura Levitin. This is my partner, David, and I'm going to start off with the literature review. Authors of this article use the CDC as a guideline for who is more active in exercise among sex, men or women. The author hopes to achieve and design a program for the midlife to older adults that have sedentary lifestyles and associated health risks. Programs will be reviewed based on efficiency and how well they work before they can be used and translated to real-world programs. Through a U.S. Task Force on Community Preventative Services, community-wide campaigns are recommended. The author hopes to translate the interventions into default community settings and believes it will have a large health improvement impact across the board. The author focuses on two physical activity objectives that relate to improving health in mid to older adults. Intervention approaches were recommended and thought to be effective across diverse settings and population groups. When emulating an intervention in the real world, adaptations must sometimes be made. Lattimore et al. Continues his article by going over the methods and procedures in detailed and easy-to-read defined sections. Most of the limitations came from the method and procedures portion of the article, including being able to translate sites into Spanish for Spanish-reading individuals such as Latino, Hispanic, and Filipinos. Limitations of the study included user-friendliness of the program materials for the specific intended audiences, since the original program materials were developed for a broader audience. Problems were also found implementing the program curriculum. Normal communication issues also arose, with data not being transcribed due to miscalls or miscommunication. Sites complained of problems comparing intensity between light and moderate workouts. Other limitations included the duration of the sessions and the time length of the sessions. Challenges and limitations were reported based on the readability of the material because of small fonts, the literacy level being too high, and the graphic limitations, where those who were studied were thought to be misinterpreted. No tables or charts were provided in this analysis, possibly limiting thorough analysis of the results.
Awesome. The methods portion, specifically the Active for Life program. The Active for Life program was developed as a research to practice transitional initiative for midlife and older adults who were irregularly active but not achieving the CDC and Prevention and American College of Sports Medicine minimum recommendations for physical activity. Specifically, the programs were developed for research to practice programs for older adults to get them more active within their lifestyle. The two physical activity programs that were chosen to kind of analyze and detail the kind of descriptive data was the Active Choices developed by Stanford University and the Active Living Everyday program developed by the Cooper Institute in Dallas, Texas. Both programs use social cognitive theory and trans-theoretical model. The biggest issue about the social cognitive theory was that it's very relies heavily on self-realization. The article talks about the key components of SCT are self-regulation skills, self-monitoring, setting goals, problem-solving, rewards, self-efficiency, and behavioral compatibility. One of the problems with this is you can have an individual who doesn't self-motivate very well and can affect the program, or overly self-motivates and can affect the program in either way. Both programs help participants gain the behavioral skills necessary to increase their moderate physical activity into their daily lives, basically aiming to help them motivate and realize their lifestyle choices and change them. Additionally, there were 2,796 participants within the Active for Life program, and and they analyzed specifically the first 2 years of the program because it experienced a lot of difficulties within their challenges as far as focus during the time period, challenges within their workouts, and the adaptation implementation of the program within their own life. Excuse me, within the analysis portion, the first 2 years, 7 interviews were completed with each site or each program that implemented the data or implemented the program. And the data was collected through various telephone interviews and program implementation notes submitted by site staff via an electronic database. Each site facilitated their own bi-monthly interviews and analysis projects conducted by interviews, note-taking, workout partner interviews, etc. And by month, they also use group conference calls with lead staff from each site to discuss kind of what each group is going through and each group is experiencing. And one of the issues with this is the article doesn't speak about the kind of intrinsic nature of what exactly is a problem that a person might experience in later life workouts, or what is exactly a problem that they might suffer during a workout, out of life during the workout, etc. It talks about it in the article a little later, but initially it does not explain within the data collection how exactly what a problem is. The article goes on to talk about 6 program-specific group calls facilitated by the program developers with lead staff from each site, also conducted to discuss issues regarding program startup and implementation. They were also scheduled based on perceived needs, another big issue. What exactly is a perceived need by an individual or an individual's group? In all, 30 monthly or bi-monthly conference calls facilitated with staff from the various target sites, evaluation teams, and a sustainably overview team as well. And they also looked at to keep the call agendas and developing on priority issues. Exactly, main thing again, what exactly is a priority issue within a group's own workout plan? Totally an electronic database was used to gather site-specific data about the program. Although each program used an electronic database, the data was gathered at different bases on different program components, such as face-to-face sessions, conference calls, phone calls. Each site did not technically use a specific type of research data collection method. It was more of some would use face-to-face, some would use group calls, some would use conference calls. It varied between each. The analysis portion is kind of interesting because, like I said, it kind of grouped everything into a lump sum, basically, problems. What exactly is a group's problem? That's the biggest issue with each. Qualitative analysis were based on a grounded theory approach. Central to grounded theory is the continual process of examining data, comparing codes and categories, and comparing emerging themes until the data has reached theoretical saturation. The process begins with open coding, which is a process of identifying concepts within the data. And the article begins to analyze how they view problems and how they view each site's definition of schema and how they view the issues. By using the grounded theory approach, phenomena are not preconceived but instead surface on their own, providing a truer and less biased picture of challenges community organizations experience throughout implementation. Basically, the article looked to view it as a whole within the community and kind of how it approached bettering an individual's lifestyle and how it helped middle-aged to older people implement these things that Active for Life tried to do, and how it helped or did not help groups of individuals. And this kind of leads into the results portion.
All right, the results section. There was actually a specific results section labeled. but actual results could be found throughout the paper more than just in the results section. Qualitative analysis were recorded using a software package called NVivo. Qualitative findings were reported further and obtained from the NPO, or the National Program Office, and the RWJF, or Robert Wood Johnson Foundation. 3 result categories were looked at: program logistics, program theory, and program philosophy. Results focused on the data collection methods and were provided to assess program implementation, participation, and fidelity. Data was collected through telephone interviews and program implementation notes submitted by site staff via an electronic database. Results focused on the first 2 years due to most challenges occurring during that time frame. Results were assessed via conference calls that were set up with each lead staff to discuss challenges, implementation, and site updates. Calls were audio taped, and the NFO produced detailed notes from the audio. An electronic database was used to gain further results on program implementations, and results were well explained, including any difficulties that were encountered. Challenges or adaptations were measured in detail and were changes to the components of the program or intervention, as were. The most prominent challenges in each category are described in detail. A 12-week program was developed that was much more useful than an originally planned 20-week program. It better fit the organization, and classes could more easily be scheduled. Analysis showed that although sites faced some challenges, they were able to effectively deliver and provide adaptations for 2 evidence-based physical activities applied to a large and a diverse group of middle to later aged adults. The effectiveness of the program was implementation and was seen by the increase in physical activity outcomes for both programs. Moving on to discussion. Discussion was noted and labeled in the paper. Results and findings were given in detail and reported more thoroughly in the Griffin et al. Article. It is important to understand that well-documented benefits to physical activity, as well as the highly studied negative effects of inactivity. In order to maximize the public health impact and successfully change behavior among diverse, midlife, and older adults, it is important to implement evidence-based physical activity programs that can be translated efficiently in multiple real-world settings. The idea in a wellness program is to expect adaptations. It should be noted that adaptations could both hurt and help a program, making it imperative that adaptations are looked at closely. Using qualitative research methods, the article was able to better assess the challenges faced by organizations when trying to translate an evidence-based initiative to a community spread initiative.
All right, talking about the discussion was interesting for two reasons. They talk about the challenges and adaptations should be expected when evidence-based programs are translated into real-world community settings. Some challenges will threaten program fidelity, and the big issue is defining fidelity exactly. And it goes on to give 2 examples, focusing on content essence of essential elements. That's important because the document as a whole talked about the problems and issues with each program and how it can cause programs to fail or succeed. And really defining fidelity is important because it can help the Active for Life program understand what is really needed within a group's kind of workout mode and how they go about implementing a program. And another big important thing about the conclusions is the applications for study column or section that either one you'd like to say. It goes on for 3 questions: implementations for health program practitioners and researchers. What is already known on this topic? What does this article add? What are the implementations for health promotion, practice, or research? And this is extremely important because it gives a kind of background or preview basically to what this study really does and what it really goes on to help. And it goes about talking about what the article adds as a qualitative research method and within the data portion. The final portion of the conclusion is what are the implications for health promotion, practice, or research. Article's main aim is to basically see how programs succeed within older adults' lives. And I think that's the biggest importance for the article as a whole, to understand what older adults see within programs that help them succeed health-wise engaging in a workout, and etc. Things like that. And the biggest issue for the, not really issue, but importance for the article as a whole is the implications for health promotion. And the overall discussion within the article is that bigger issue of health within older adults.
All right, and that's our article critique.
Yes, ma'am.